student nurse today, and I'm just going to do your head to toe. Can I please have you state your name, the time, where you're at, and why?
My name is Tyler. It's Sunday. I'm at the hospital and I'm getting my checkup.
Perfect. Patient is alert and follows command. He is well orientated to the person, place, time, and situation. He is well appearing and not in distress, and his behavior is consistent with the situation. His general movements are symmetrical. His crude hearing is intact, and his speech is clear. And then Tyler, I want you to go ahead and smile with teeth for me, and then raise your eyebrows. Perfect. Face is symmetrical with facial expressions, including smiling really big with teeth and putting his eyebrows up. And then I want you to go ahead and look over the shoulder for me, okay? And then the other shoulder. Perfect. And then I'm going to introduce something to your line of vision. When I say focus, I want you to focus on it, okay? Focus. Perfect. Pupil size is 3 milliliters bilaterally. His pupils are equal, round, reactive to light in both direct and consensual with accommodation. And then I'm going to go ahead and have you stand up for me. And then we're just going to test your walking, so if you can just walk normal. And then go ahead and turn around on your tippy toes. And then on your heels. And then walk back in tandem for me. Perfect. Good, go ahead and sit down for me. Gait is smooth and coordinated. And then I'm going to go ahead and have you close your eyes, okay? When you feel something, I want you to say now.
Now? 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 Now?
Alright. Light touch sensation is intact in the upper and lower extremities bilaterally. And then I'm going to go ahead and do your cardiovascular assessment, okay? So skin is consistent with ethnic background. There are no visible lifts, heaves, or pulsations. And then I'm going to go ahead and auscultate the precordial sites. Usually I would use the diaphragm and bell, but for the sake of the video, I'll just do the diaphragm. So we're going to go ahead and start off with our aortic valve, which is in the right second intercostal space. The pulmonic, which is in the second left intercostal space. The Erb's point, which is in the third left intercostal space. The tricuspid, which is down the sternal border of the left side. And then the mitral valve, which is the left midclavicular line of the fifth intercostal. So S1 and S2 are present, S3, S4, and murmurs are not present times 5. And then since we're already on the mitral spot, the mitral valve, the apical pulse is at the same spot. So we'll go ahead and listen to the apical pulse for 60 seconds. 1, 2, 60. The apical pulse is regular, and the rate and rhythm is regular, and it is 60 beats per minute of the apical pulse. And now I'm going to go ahead and do your peripheral vascular assessment. So I'm just going to do 1. And then going back up, I want you to say if it's tender for me, okay? Is it tender?
No.
So skin is consistent with ethnic background. It is warm and dry. The upper and lower extremities are symmetrical bilaterally, and there are no lumps, lesions, or masses present. And then I want you to go ahead and point out your index fingers. Capillary refill is less than 2 seconds. And then I'm going to go ahead and do your radial pulse. Radial pulse is +2 present bilaterally. And then your pedal pulse. Pedal pulses are present +2 bilaterally. And then I'm also going to test for your pretibial edema, okay? So no pretibial edema present bilaterally. Now I'm going to go ahead and move on to your respiratory, okay? So I'm going to have you lift up your shirt for me. Perfect. And then I want you to say if it's tender, going back up.
No.
No? Perfect. Okay, so skin is consistent with ethnic background. It is warm and dry. The thoracic shape is symmetrical. There are no lumps, lesions, masses, or cyanosis present, or tenderness. And then we're gonna go ahead and auscultate. But first, I'm gonna test your trachea. Okay, so I want you to look up. Perfect. The trachea is midline. Sorry about that. And then I'm gonna go ahead and auscultate. Usually, I'll auscultate for a full respiration, but for the sake of the video, I'll just show location. So 1, 2, 3, 4, 5. To go ahead and put your shirt down. So anterior lung fields are clear in all lung fields with no adventitious sounds present. And then I'm gonna have you turn around for me. And then we're just gonna lift up your shirt. Sorry. And then going back up, just let me know if it's center, okay?
No.
No? Perfect. Okay, so skin is consistent with the ethnic background. It is warm and dry to touch. There are no cyanosis, masses, lesions, lumps, or tenderness present. And his shoulders are symmetrical. Now I'm gonna go ahead and listen to his lung sounds in the posterior field. 1, 2, 3, 4, 5, 6, 7, 8, 9. Perfect. So posterior lung fields are clear in all lung fields, and there are no adventitious sounds present. And then I'm just gonna have you turn back around for me. And then going back to the anterior side, his respiration rate is regular and unlabored, and with 12 breaths per minute. And then now I'm gonna go ahead and move on to your gastrointestinal, okay? So I want you to open up your mouth. Perfect. So teeth are white and straight. His gums are pink and moist with no bleeding. His buccal mucosa, tongue, and soft palate are pink and moist. His hard palate is white and moist. His tonsils are present +2 bilaterally, and there's no halitosis present. And then I want you to go ahead and swallow for me. Perfect. Swallow is intact. And then I want you to go ahead and lay down for me, okay? And then I'm just gonna lift up your stomach just a little bit. So, sorry. Skin is consistent with ethnic background. There are no lumps, lesions, or masses. His abdomen is symmetrical, umbilicus is midline, and his contour is flat. And then I'm gonna go ahead and auscultate your bowel sounds, okay? And I'm gonna auscultate in all 4 quadrants. So 1, 2, 3, 4. Bowel sounds are normal active ×4. And then I'm gonna go ahead and do your skin turgor. So it's gonna be a really quick pitch, okay? Okay. Skin turgor is brisk with no tenting. And now I'm just gonna go ahead and do your palpations. So let me know if it's tender.
No.
And then tender.
No.
No tenderness? Perfect. There are no tenderness present upon light and deep palpation. So I'm going to have you sit up for me. And then now we're going to move on to your musculoskeletal, okay?
Okay.
So, and then going back up, let me know if it's tender.
No.
No. No? Perfect. Okay, so upon inspection and palpation over the joints of the TMJ, cervical spine, thoracic spine, lumbar spine, shoulders, elbows, wrist, hands, fingers, hips, knees, ankles, feet, and toes. His skin is consistent with the ethnic background. It is dry and warm to touch. There are no masses, swelling, deformities, or tenderness present bilaterally in the upper and lower extremities. And then I'm going to go ahead and have you, we're going to do your range of motion test, okay? So I want you to go ahead and open your mouth and then protrude out. And then, yeah, partial close and then move side to side. No, your jaw, sorry. And then go ahead and close for me. And then clench. And then clench. Perfect. And then I'm going to have you stand up for me, okay? So you're just going to follow what I do. So cervical, I want you to bow down, head up, and then back, side to side, and then rotate. Perfect. And then for your thoracic and lumbar, I want you to follow me, okay? And then back, and then side to side, and then rotate. Perfect. And then for your shoulders, I want you to shrug, back, forward, back, hyperextend, and then I want you to abduct. Sorry, and then abduct. Perfect. And then for your elbows, I want you to flex, extend, pronate, supinate. Perfect. And then your wrist, I want you to flex, extend, hyperextend, go back, invert, evert, circum, and then circumvention. Perfect. And then for your fingers, I want you to abduct, adduct, flex. Yes, perfect. And then I want you to go ahead and lay back down for me. Okay, now we're just going to do your hips, okay? So I want you to flex up, and then go in, and then out, and then go back down, and then go out, in. Perfect. So we'll do the other side, okay? So flex up, go in, sorry, and then out, and then back down, and then out, in. Perfect. And then if you could just sit up for me. We're going to go ahead and test your knees, okay? So I want you to flex up, extend up, and then flex down. Perfect. And then do the other side. And then down. Perfect. And then what I'm doing with my wrists and fingers, you'll do with your toes, okay? So we're going to go ahead and plantar flex up, dorsiflex down, and then circumduct. Circumduct the other way. And then we're going to go ahead and invert, evert, and then we'll go back. And then for your toes, I want you to abduct, adduct, and then flex. Perfect. There is full active range of motion in the TMJ, shoulders, cervical spine, thoracic spine, and lumbar spine. The elbows, wrists, fingers, hips, knees, ankles, feet, and toes. Thank you so much for letting me do your head to toe.
Thank you.